This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, the burning question this morning is, are you tired of eating turkey? That's the question. And probably you are, but that's okay, because we have a lot to be thankful for.
We do, right, we do.
On our Thanksgiving weekend. Good morning and welcome to the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, as the man said. And as the man also said, Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates in Marlton, New Jersey. And what do we talk about here on this show? Specifically, your health, you and your family's health, how Dr. Molly and her team can help you to improve your quality of life. That's what we call our mission statement. And we always like to say we go through the who, what, when, where, why, and how of Innovative Medical Associates. And, of course, as always, if you have questions for Dr. Molly, 855-839-1210, 855-839-1210. We know that we're entering the holiday season, but things are business as usual. You still got to be healthy, and that's what we're here for.
Maybe more so, John.
That's more so, right. 855-839-1210. That's the number here in the studio this morning for Health Watch here on Talk Radio 1210. WPHT. A lot to talk about this morning, Dr. Molly, but first let's get into, how you have helped people continue to be healthy for a holiday.
Well, I hope so. If you look at us, John, we are a licensed primary care facility. And in this licensed primary care facility, I have a group of healthcare providers who work out of my facility. And what we can do is anything that you can get in any primary care or family practice office. So you need this week I've probably been involved with several people who needed a Z-Pak, right? Sinus infections. And they definitely were infections, not viral. So we can give you any prescription you need. However, I think the philosophy of my medical director and certainly of myself is that we want to use the least amount of the pharmaceutical necessary to correct the medical challenge, not put the patient at risk, and then augment that with natural substances like vitamins, minerals, amino acids, kinds of things you could find at the health food store. And what we use is hydration as the vehicle for that. So, meaning we want to give you a dose that's appropriate, functionally get you back into the workplace business. Most of my people are very anxious to get back to work. It's unbelievable, right? Huh?
They come on their lunch break.
Yeah, man. People say, I need all. My people say, let's get back to being totally functional, and that's what we like.
Interesting that you utilize the hydration and the natural substances.
Sure.
And you don't always replace a prescription, but it's to
augment. Augment. And it's exactly what I like to say. We are an integrative functional medicine clinic. In other words, we're not a spa. I mean, we can do the spa things, hey, you have a hangover. We can give you an IV for that. But that's not really our focus. Our focus is we want to tune up the body's immune system biochemically, make sure everything's in line to help you with whatever challenge you have. And, John, I see a lot of challenges.
I know you do. And we're going to talk later on about a challenge that you made or that came to your office. And really, I mean, you saved the person. And we'll talk about that a little bit later on. But talk about what happens to a lot of people, and they end up coming to you, is that they get a prescription, and then that prescription does something.
Right.
So which means it's an adverse effect.
Right.
So then they get prescribed another prescription to offset prescription A.
Right.
So A leads to B, which could lead to C, which could lead to D.
Well, that's exactly what I see. People come into us with basket loads of pharmaceuticals. They come in with basket loads of natural substances too. But the pharmaceuticals are amazing because they're generally prescribed, and when people have a side effect to one, they end up getting what they consider the remedy to that side effect, not getting off the prescription. Or sometimes I've actually seen one patient come into me and the doctor told her to double the prescription. It'd be okay. You got to reach a threshold. Well, the only thing is, listen, I see this a lot with the statin drugs, and I see it with many of the drugs, blood pressure meds. What we want to do is we want to bring the body back in balance by utilizing the natural substances to augment the prescription drugs. You will never hear me say, throw out your prescription drugs. First of all, I know that's a very bad thing to do. Secondly, we don't want to put you at risk. What we want to do is help you possibly reduce them, but certainly help outcome of your particular problem by bringing in the natural substances.
Do they work?
Yes.
You get that question every consultation.
Yes. And so, can I show you the qualitative data? Sure. Look around, see how well my people walk around, see what they're talking about. They're fully engaged. But I can also show you the quantitative data. Okay, we see improvement in pain. We also see improvement in the blood work. So it's a combination. Pain being more subjective, but we'll see a difference in the blood markers, including the inflammation markers. I had a situation this past couple weeks where a patient tested beautifully on all her inflammation markers except for one. And it was very significant for that patient because it was specific for cardiac. And guess what? She's on several cardiac meds, and she has a history of congestive heart failure. So we didn't take her off the congestive heart failure medication, but what we did was we put an IV together to really address the inflammation that we were seeing with the cardiac marker.
Explain when you're talking about hydration, and a lot of people ask you when they're getting treatments, oh, what's in my bag? My bag is different. His bag over there.
Or how about when they say they look alike? Oh,
yeah. That one looks alike, but that one over there is orange. Mine's yellow.
Yeah.
And so on and so forth. But I know you can't be specific, but in general, what are in these hydration bags to help effectuate change?
A lot of things are in them, okay, including, your old friend vitamin C is in almost every one, except if someone can't utilize the vitamin C. But vitamins are in there. Amino acids are in there, depending on what it is we want to accomplish. For example, we might use something called EDTA to accomplish getting rid of the high cholesterol by utilizing a particular amino acid that claws out calcium, not the calcium that we need for our bones, but the free-floating calcium that really causes the plaquing. So there are many things we use. We might use certain amino acids for muscle strength. We might use homeopathics. We might use things that affect the cytokines, inflammation cytokines. So again, it's not one size fits all, John.
A lot of times you have had patients who have had cancer, and they come to you for your cancer support protocols.
Yes.
And they sort of help with the immune systems are compromised as a result of maybe some chemo and that kind of thing. So talk about how you're able to do that.
Well,
and what do you do to help them improve their quality of life?
Well, I'll tell you, I have several cancer patients in the chair right now, some getting the immunotherapies. And what we have to look at is the immunotherapies are targeted therapies, allegedly, that go after the cancer cells. But in doing so, they're still affecting your own cells. So many people are pretty sick through the immunotherapies. The question is, can we help that patient get through this and keep their own immune system where it needs to be to help these targeted cells just go after the cancer cells and not destroy the patient in the process? That is true for the chemo cells. And yes, we have certain protocols for certain types of cancer. For example, blood dyscrasias are treated one way, hard tumors are treated another, so it's a little complex.
But nevertheless, you're able to help them because it's a difficult process to begin with.
Exactly. What we don't want them to do is succumb to the treatment of cancer, the traditional treatment, and not make it to the other side and get their immune system back up. I spoke to one of my cancer patients yesterday who called me, who had an unfortunate situation where someone in her home tested positive for COVID over the holiday. She was very upset because she said, what am I going to do? I mean, I'm in the middle of the chemo. They don't want to see me. I said, well, I find that a problem.
Yeah,
but nonetheless, I said, look, let's do a test. Let's see where you are, isolate you, and I think I want to support you through this, get you on the other side, and make sure that your immune system is not compromised enough that you can't fight off the COVID.
We are coming up on our first break of the morning. Our program is called Health Watch, and you'll find us here every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. You got a question for Dr. Molly? You got a medical challenge you want to run by her? 855-839-1210 is the number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. More Health Watch after these words. And we're back here on Health Watch. Operators standing by right now at Innovative Medical Associates, 856-489-0505, 856-489-0505. You want to call and get some information, they'll be happy to share that with you. And you want to make an appointment to sit down with Dr. Molly, well, that's what you do, because that's where you can really get a lot of good information from her. 856-489-0505. The initial consultation is complimentary. Dr. Molly does meet with a lot of folks who listen to the program, so if you want to be one of those, feel free to call 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones, talk to Tom in Pennsburg. Tom, good morning. You're on Health Watch with Dr. Molly.
Hi, Tom.
Hi, hope you had a great Thanksgiving.
I hope you did too, sir.
Sure did.
Good.
Anyway, I was just wondering how you deliver fat-soluble nutraceuticals.
Good question. Very good question. It depends. Okay, if you're talking about things like vitamin D, etc., what we usually do is we utilize obviously hypodermics and give some things in terms of shots, IM shots. Also, as I said before, we aren't against giving out nutraceuticals. The problem is we want to do, obviously, the kind of things that really work. So we're very fussy about brands, of which we don't have any interest in any nutraceutical company. So it's a good question, and John can attest that sometimes during our IV therapies, we do indeed give some shots, meaning IM shots, and that's necessary. So I agree with that, and we don't take a chance. We don't want clots. We don't want to hurt anyone. We're not looking at that, and it does work. And do I have some of these particular fat-soluble items in stock? You bet. So it depends. I also have a great compounding pharmacist who can mix this up so that I can utilize it by IM. I hope that answers your question, my friend.
Okay, and another thing, do you have anything for gallbladders?
Many things for gallbladders. Okay, many things for gallbladders. First of all, I would say that the gallbladder, you've got to look at the gallbladder in terms of the liver, in terms of the whole biliary tract, and indeed we do. I would use ALA. I would probably use glutathione, and I have a tremendous number of homeopathics that actually I believe in utilizing Jerusalem artichoke as well. That's an interesting. It actually was very prominently used in Italy and of course in Israel. And again, interestingly enough, I actually have a particular nutraceutical in, and I don't sell too many. I actually have a honey that has an awful lot of properties that tend to help the gallbladder. So yes, and herbals, there's a ton of herbals out there. Give me a call at the office. I'll happily give you a list. Are you having gallbladder? Are you having stones, or are you having other types of problems with the gallbladder?
The wife has a couple of nodules on the gallbladder.
Ah, yeah. You know what? You're not that far from me. Come on into the office. I'd love to talk to you about that. Absolutely. God bless
All right,
you,
Tom. Good luck with that, and good luck with your wife with that. Thanks for the call.
Thank
Appreciate
you.
it.
That was a nice call.
Yeah.
Nice call, because I think people don't realize that, strictly with the hydration, we do deliver IM shots, or we deliver hypodermics if you need them. Now, I can tell you that generally we have a great outcome. For example, we have our vitamin D in particular types of oil. We don't just use the manufactured type. So we're looking at some of the oils along with it, like olive oil and some others.
All right, before we get back into the show, I wanted to mention this, of course, being a holiday weekend, and we just went through Black Friday, and if you fought the crowds and you fought the malls and all that stuff, and you couldn't get online because everybody else was, a couple of thoughts for holiday gifts. Dr. Molly has her latest book, God's Ingredients TOO, My 30-Year Journey in IV Nutritional Medicine. It's a great book, and it's available on Amazon.com. Now, that's a gift you can give someone that's useful. And so they
You're
can,
very kind, John.
But that, you read it and I'm going to get healthy. So there you go. That's number one. Number two, as you've heard us say, Dr. Molly has a complete line of skincare products, and we're finding that people are contacting Dr. Molly and saying, hey, I've been using some of them and they're working very well. So go on the website, innovativemedicalassociates.com, innovativemedicalassociates.com, and you'll see there the complete line of skincare products. That's another good gift for the holidays. Something very useful.
John, I was out this weekend, and that's how this came up. I was out, and a woman who is a mother of a friend of mine said, hey, I got your skincare products. I said, you did? I said, well, thank you very much. And she said, no, thank you. She said, I'm feeling really good. Look, because I commented, I said, Mrs. So-and-so, your skin looks so great. She said, I know, I'm using your product. So I'm moving. You
were impressed by your own product.
I took a step back and I said, well, thank you very much. But it was a funny exchange. And I started to think, I don't want to put out that we treat the skincare products like a stepchild, because they aren't. As you know, Dr. Glass was on the show last year, and I'm going to have him back for some of the new developments we're doing. And he said, just remember, the skin's the largest organ. And what Dr. Molly and I have done, and I appreciate this, is we've put products together that we know work inside. Now we've got them working inside and outside. And if you look at all the TV, now it's the latest thing. I was 7 months ahead.
Exactly.
But it is the latest thing. So, and we try to make sure that it's priced appropriately.
All right, so you go on innovativemedicalassociates.com and you can check that out.
Thank you.
Health Watch is the show. 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly, 855-839-1210. I know you wanted to talk about one of your favorite subjects, leaky gut.
Yeah, you know why? I think it's appropriate today, because how many people are sitting around groaning after this holiday? And it's interesting. One of the things, as everybody knows, I'm not a physician. Let me put it right out there. I'm not a physician. I am a scientist by trade. And one of the things I'm always interested in is what new things are out there, and what is the new medical slant on certain things like leaky gut. When you come from a position that we do, we know that leaky gut is a true bona fide challenge, and we've seen people who really have this type of problem. But it's interesting to me because a late discovery, in fact, it was discovered in 2000, which means it's a relatively new discovery. We found a protein that really is synthesized in the intestine and the liver cells, and it actually inversely affects intestinal permeability, which then leads to leaky gut. This particular protein is called ZONULIN, ZONULIN, zonulin. And it was named after actually a bacteria that was found in cholera that contributed to diarrhea. And so the Italian scientist named it after that with a couple of changes on the end. Okay, very smart guy. Anyway, the thing about this goes exactly to what Dr. Molly always talks about. You know, the Goldilocks theory, John? here's the thing. In this case, they found that older people tend to have an elevated amount of this zonulin. And when we have that happening, the elevated amount, not lower in this case, elevated, what happens is it allows more toxins to go through the lining of the intestine that then contributes to what? Inflammation. And that contributes to what? Generalized inflammation, not just in the intestine. So I'm very interested in what kinds of things affected this zonulin. And I've known all along that obviously doing the diets of the gluten-free and all of that, because there's a component in gluten and wheat that definitely elevates the zonulin that then causes people to have localized inflammation. But I started to look at this and said, what kind of nutrients would affect zonulin in a positive way to keep it at the Goldilocks level? And one of the things that I was looking at, and something I've used in my leaky gut IV treatment, has been glutamine. Glutamine, it's an amino acid. And it's very interesting because glutamine can help with this, lowering the amount of zonulin. And for years, we've been using a nutraceutical IV to help patients through this because that inflammation becomes systemic. Vitamin C is another one that we're using in this. So again, I want people to realize we've got to think not just in one area, but we've got to think about all of these things systemically and how it affects the body. Inflammation in excess becomes what? The devil.
Yes.
We need it.
You've said it many times.
We need it. But boy, if it's in excess, we then have the devil is loose, not just in the gut, but throughout the entire body.
How do you know you have leaky gut? Is it something you have a
Well, I'll
symptom
tell
for,
you
or
what, if you have any type of digestive problem, if you feel autoimmune problems have been traced back to leaky gut, in particular skin problems. And I have a very, very interesting IV kind of protocol for that I'm using for people that have psoriasis, eczema, that kind of thing. It's an inflammation. It's an inflammation process, but it starts in the gut. So even today with this data on zonulin, regular physicians who do GI work are looking at the GI system as very, very important for people who have skin disorders and autoimmune conditions all the way through.
All right, we're coming up on our halfway point of the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You have a question for Dr. Molly right now? We always tell you at this point, call in right now because we don't want to have you call in at 2 minutes before 9 and then we can't take your call. We got to leave. That's pretty much how it works. So call right now, 855-839-1210, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return. More Health Watch after these words. Operator standing by right now at Innovative Medical Associates, and if you have any kind of a question or you want to make an appointment with Dr. Molly, well, what you do is you call them right now, 856-489-0505, 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. Of course, you want to wait till after 9 o'clock. The operators will be there. They'll be there pretty much all day, so you can call them, 856-489-0505. And also the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. And our show is Health Watch, and you'll find us here every Sunday, our live version, 8 till 9, here on Talk Radio 1210, WPHT. Our number here in the studio, 855-839-1210, if you have a question for Dr. Molly. And with the news this week, Dr. Molly, of the new COVID variant,
so,
your phone was ringing off the hook, right?
Wait a minute. But is this the new or the newer or the newest?
I think it's the newest.
The newest. Right. So, I mean, look, haven't we all gone through flu virus year after year? And if you are an intelligent person, which all our listeners are, don't we know that this thing changes? Right? Do you think that's why, for example, the shot you got last year, you can't get this year? But do you think this is true with the COVID? I think it is. I think I am so upset about everybody being in fear of this thing. You have to stop being in fear and be prudent. We know what you need to do. John, you and I talk about this all the time at the clinic.
That's right.
What do we have to do? We have to keep our area as clean as possible. You have to use the Lysol, the antibacterial wipes. You have to wash your hands. You can't be cavalier. You do everything you learned in kindergarten, right? Isn't that right? We do that. Now, in addition, now all of a sudden we have to fear this new thing, and they're talking about that the shots that we got are not going to work.
It said this new variant has an aversion to vaccines.
Okay, so here we are. I would say every flu has an aversion to vaccine. Right. Every virus has an aversion to vaccines. It doesn't want to be wiped out. But the bottom line is, what's the most prudent thing to do? Keep your own immune system up. And I will tell you, time and time again, I talk to my patients. Now, that doesn't mean you're not going to get it. I'm not God. I don't know about this plague. But the thing I do know is that if we stop living in fear and we become prudent, whether for you that means wearing your mask outside in a large group, that's okay with me. I have no issue with that. Getting the vaccine, I have no issue with that. I'm not an anti-vaxxer. Or maintaining your own health, I'm 100% for that.
Right.
And that is the direction we believe we like to go in at our facility. And how do we do that, John? We keep inflammation down. We're already exposed. Here's the thing. We're exposed to so many toxins and bacteria every day, aren't we?
Yes.
We are. So who's getting sick? Who's the people getting sick? They already have weakened immune systems, or they have previous exposures. I had a situation in my own clinic. Looking at someone's medical records, I didn't see any indication that patient had a previous lung exposure. Well, as luck would have it, he came down with COVID, and he comes to the clinic, and I look at him. I sent him immediately out for a chest x-ray. Got the chest x-ray back, by the way, very quickly, because God bless Barbara and my staff. They were on it. And we saw that he had the infiltrates, which means the inflammation pattern of a COVID patient. And it was mild, by the way. The x-ray said it was mild. Called Dr. Testa. We had a conversation. I said I'd like to send him to the hospital. He said, Dr. Molly, you are 180% right. Get him out. Send him to the hospital. I did. He didn't want to go. Right? He said, I feel good when I come here. I said, and I want you to continue to feel good. You need to start the traditional treatment of the monoclonal antibodies and whatever else they're doing. Send him over to a city hospital, which we know that Dr. Test is, a member of. Guess what? He's 100% well. He's being treated. He's getting out on Tuesday.
Can you say that you saved him? I mean,
I don't want to say that, but God saved him. God saved him, and he did not want to go in. So here's a case, folks, where again I point to the fact that our facility is traditional in the fact that if we see that something is seriously wrong, we're going to send you out to get it done.
That's right.
Right? We're not going to just give you some vitamin C. However, I will tell you that he had come to me the week before, tested negative for COVID, right? Tested negative for COVID, and we were giving him plenty of vitamin C and our COVID protocol. Do I believe that helped save his life? I do.
Just going to ask you that.
I do.
That's what helped.
I believe that helped, and the fact that we got him in to get the monoclonal antibodies right away. Good story, true story, and one that I just sit back and say, okay, here's the reason why you go to an integrative facility, not just one way, but back to our Goldilocks theory, when things need to be in balance with your body.
How often have you and I talked, not only on the show, but as you said, in the clinic, we've talked about the immune system and how the vitamin C and the hydration helps keep that really up.
Yeah, and how about
prevents
these
things.
Right, or can help you through these things.
Right.
Let's look at let's be realistic. People are not sitting home in a glass jar. Well, maybe some people are because they're scared to death.
Right.
They're in a bell jar. It's unbelievable to me. What we're doing is we're scaring everybody into sickness, to tell you the truth. Really?
Yeah.
Think about it. Why don't we get proactive and maintain our immune system? Listen, you hear me talk about things like beta-glucan. We know that helps. Talk about utilizing the B vitamins. Talk about keeping the rest of your body. You know what I'm worried about? We're so worried about COVID, we're forgetting about everything else.
Yes.
I hear it.
Yeah.
Look at my patient. They didn't want to take her for her chemotherapy. Oh, well, they said it won't matter for 10 days or so. Well, if it didn't matter for 10 days, why is she on it?
Exactly.
She comes to you because she's scared to death about this cancer situation. And I agree that the chemotherapy is important. Can't you isolate her? She doesn't have symptoms of COVID. I'm beside myself about this. Like, you don't have symptoms of COVID, so you test, somebody in your household tests positive. You're testing negative. You have to be quarantined too. They're not worried about her cancer. This institution obviously is not worried about her cancer. I am.
Yeah.
I am.
I know you are.
Okay.
Yeah.
So I don't know, John. I feel like I'm living in a medical oxymoron kind of thing. I don't know what's going on.
Right. And I agree with you. But the bottom line is, we've often said it, that the immune system being maximized can help prevent a lot of things.
It's the gateway to your good health. And I will tell you that sitting in our chair and utilizing a program to enhance the immune system, the God-given way to fight things, helps. I'm not saying it's the only thing. You need an antibiotic, we're going to give it. You need an antiviral, we're going to give it. But I will tell you, it certainly works infinitely better after you've had a course of treatment to enhance your own immune system.
Which brings me to the question of, and you've often talked about this, the course of treatment. What can people expect? I know in the initial consultation they ask this.
Sure.
What can they expect?
It depends, right, John? It depends on what you're coming to. Obviously, I have people like you who are lifers. You have several comorbidities. I don't want you hanging out there. Doesn't mean you have to go steady with me all the time.
Right.
But you have to continue to keep your reserve up. And that's something I absolutely unequivocally believe in, the reserve. And that includes me and my staff. Okay, we all got trips this week because we were working 13 hours. You don't think that the stress and fatigue of working those days took a toll on my staff?
Oh,
you
absolutely.
bet it did.
Absolutely.
But not as greatly as it could have been. Believe me, because of what we do in-house.
So all the staff gets strips.
Oh, yeah. Absolutely. Absolutely. No matter what.
That's
and
like the shoemaker that walks around with
you
don't do that. Well,
right. No, I try not to because I have a comorbidity. Listen, John, I'm walking around through this virus, okay, and I don't spit in the wind, and I thank God every day for my health being here right now.
Yes.
Because I came off of a terrible situation. But I can tell you this, if you're not proactive and you sit in limbo and you're in inertia and you don't do something for yourself, nobody's going to do it for you.
That's right. And certainly you have practiced that over the years.
Absolutely.
And you have told your patients the same thing.
Really?
This is what you got to do.
This is what you got to do. And I'm a big believer. One of my favorite things is vitamin C. The extracts are important to me. I'm a big believer. And I have to tell everybody out there, we've got to join the Alliance for Natural Health because the FDA is trying to limit the compounded products we can get. I mean, this is going to be detrimental to your health if you don't.
Is money a factor in this, you think?
Oh, you bet.
Of course it is.
Hey, listen, now I'm sure we're going to come out. What are they going to do about this new variant? If they're saying that it's the present vaccine is ineffective, they're going to come up with another booster, right?
Another vaccine, right.
I mean, or they're going to change the recipe of the ones they have. It's just, it's crazy, folks.
We are coming up on a break, which means you still have time to jump in here with a question or two for Dr. Molly. 855-839-1210. 855-839-1210 is our number here in the studio. The show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. Coming back with more Health Watch after these words. And as always, operators are standing by right now at Innovative Medical Associates. When we're here on the radio, they're there. And they will be there well after we leave you at 9 o'clock this morning. And the number is 856-489-0505. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. Also, a quick reminder, if you miss any of today's show or you heard it, you want to hear it again, well, that's good because we have our Health Watch replay every Sunday 4 until 5 right here on Talk Radio 1210 WPHT. Couple of minutes left of the show. If you want to jump in with a question for Dr. Molly, 855-839-1210, 855-839-1210. Dr. Molly, it's always interesting to hear your stories because they point out some of the things that you can do for patients. And we're going to talk about Julie.
Yeah, Julie. So, I like to say that I don't work as hard when there's a holiday, but I still try to work. And I got an email from my patient, Julie, who happens to be one of my favorite patients, although you've heard everybody say, everybody's your favorite patient. And the fact of the matter is, it's true. So Julie actually texted my office or texted me, and she also emailed me. And she was kind enough. I knew she was going for a PET scan because she has breast cancer, and she was referred to me from a surgeon who is a good friend of the clinic and understands the value in nutritional medicine after the surgery, not only to help the healing, but to really get back some stamina, et cetera, for her patients. Interestingly enough, all of her blood work was aces. I mean, they were aces, meaning nothing was out of the ordinary. The inflammation markers seemed to be holding their own. The cancer markers were back down. Everything looked good. She sent me her follow-up PET scan. Now, she is very judicious in going for her PET scans every 3 months. And she had a small lump, a small growth, let's say not even a lump, a small growth on the opposite breast. And she also had a small growth in her lymph node. And that, of course, worried the surgeon, the lymph node more than anything, because the lymph is the system where things spread, and it's an internal kind of thing. It's something that you'll hear with cancer patients all the time. Keep those lymphs moving, keep your lymphatic system up, and the way you do that, believe it or not, is through what we do and nutritionally. But interestingly enough, the lymph node we were looking at actually reduced in size. It's not there. It's not there. That's number one. Now, also, though, she did have 1/10 of a growth on the breast nodule. 1/10. 1/10. Now, that seemed to be, I would never make that call. I'm not a doctor, but I was reading it. But then I read more on the body of her note to me. And she said she had already called her physicians and told them she believed, she's a very smart girl, she would like to wait 3 more months before she would tackle that particular growth. She said it seemed to her that 0.1 was insignificant. And I have to tell you, I agreed with that. Yeah. But, I wouldn't make that call for a patient. I'm not a doc. Her doctor wrote back and said, we agree. It was a team effort. We agree. Why don't we wait 3 more months and see if that goes away? And really, it's astounding, they said, that your lymph node reduced. It's not there.
And was that because of your IV therapies?
I believe. Okay. I believe it was God. I believe it was God. God did it. But I think that our IV therapies absolutely helped.
And what was in the IV therapies?
Absolutely. Your old friend vitamin C.
I kind of thought that.
Beta glucan. And I have a whole mixture for the breast cancer that includes homeopathics that look at interleukins. You've heard me talk about this. Affecting the interleukins that affect inflammation, using the anti-interleukins that affect the certain cascading that contributes to cancer.
What's the takeaway from all of this? In that this really that your protocols really work, and because there are some people out there saying, "Nah, that can't work." You've heard it.
Look, you know what I know. The earlier you get in, the better it can work with God's help. But we can give people a quality of life. That's what it's all about. It isn't about a cure. It's not about a cure, and it's not about, we want to give you a good quality of life regardless of which way you go. You can see from the case with Julie. Am I against her going for traditional treatment? The answer to that is no one in my facility would do that. They are bona fide physicians, and I like to think of myself as a real scientist.
Yes.
So nobody's going to say don't do what they tell you to do. But what I am saying is you have some control about the quality of life you have regardless of how you go through the treatment plan. And I think that is extremely, extremely valuable and important. If, there are some things you can't control, but your quality of life you can control if done properly.
So what you're talking about is, and we've emphasized this a lot on the show, you're talking about enhancing your quality of life. You're talking about supplementing what physicians might be doing.
Right.
So
and
that's
let's look and do no harm. The most important thing is to come to a facility like ours so that we know which nutrients won't affect whatever treatment regimen you're on, might enhance it, and actually in the end do some good. Same thing with the COVID. I'm not looking to take the place of whatever traditional treatment your doctor wants to give you. I'm not trying to do that. What I want to do is help you maintain your quality of life through COVID, after COVID in particular, with all the long haulers for sure, right? I want to do that. That's what we live for. That's my mission in life.
You mentioned COVID, and throughout the height of the pandemic, I remember feeling like, I was really protected because of the vitamin C treatment.
Well, I would say you're protected from the good Lord, but the vitamin C helped. Okay, come on, John. Look, let's be honest. We have to realize that we have an innate ability to live a good quality of life. But we've got to make some efforts to do that. And that doesn't just include the IV therapies. It may include taking some nutraceuticals and also cleaning up your life. Listen, you can't come to me and drink 10 vodka martinis and think I'm going to be able to take care of your liver. I might be able to clean it up, but you got to cut that down.
Exactly. So you've got to be kind of, as you've said, your own advocate for your own health.
Exactly. And if you do that, I will meet you more than halfway and help you the rest of the way. And I've seen it work.
So are you having more turkey today? Or
No,
you're
actually,
done with that, right?
I have so much work piled up on my desk. What I have to do is return 100 emails and several other things, and that's just from yesterday. So it's
Dr. Molly never stops, right?
No, but I because I really, really do. I love what we do. I love the concept of the quality of life issue. Is what I say is it's so people cure the condition and then you have a terrible quality of life. What good is that?
That's exactly right. And that's a good note to end the show on. That's going to wrap up another edition of Health Watch. Don't forget, operators are there well after we leave you at 9 o'clock at 856-489-0505. That's the operators at Innovative Medical, 856-489-0505. Check out the web, InnovativeMedicalAssociates.com, InnovativeMedicalAssociates.com. Don't forget Dr. Molly's skincare line. That's a great holiday gift for somebody who, you figure out, I don't know what to get them. So there you go. Try that. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, don't forget our replay 4 to 5 this afternoon. For Dr. Molly Fantasia and everyone else at Innovative Medical, the lovely Linda, Barbara, Delightful D, Fabulous Fran, Joanne, and our nurses Jess and Crystal, and our medical assistant Karen Kathy. I'm John DeMasi. Thanks for listening. Have yourself a great and a healthy week. Enjoy the rest of your holiday weekend. We'll do it all over again next Sunday. Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. Take care.